Any other questions?
Yeah, so a couple
Yes.
more, Madam Chair. Thank you very much. Currently, state law has deadlines to initiate a complaint of an investigation, but there is no legislation for completing investigations. And again, being new to San Francisco, meeting people coming into my office, one of the complaints I have heard is the amount of time it takes to issue complaints, and sometimes exceeding 500 days, which puts the public at risk. What are you doing to make sure that we issue those citations in a timely way, or at least let the institution know that there's major issues that we're concerned about that are putting the public at risk?
So we do acknowledge that we have a backlog in issuing the citations. When our nurse surveyor team leaves a facility, we do at that time notify the facility of an intent to cite. And then the delay comes afterwards because that citation, to ensure that it meets legal standards, goes through multiple reviews. There's usually a physician, there's often a physician or another consultant involved in reviewing the work of the survey team. Then it has to go through legal review, and so there is a significant delay, and we do acknowledge that that's a backlog that we want to address.
Do you have any ideas on how to streamline that process? Because my concern is that with these delays, we could be duplicating problems that these institutions have been potentially going to be violated and written citations for, and we could be seeing, morbidity and mortality associated with these problems.
So one of the things that we're considering as the Hubbard report recommendations recommended a quality improvement process overall, and one of the things that we have been discussing is to do a quality improvement project specifically around the issuing of citations, which would involve, a standard quality improvement project would involve mapping out the current process, identifying where the bottlenecks are and trying to redesign that process. So that's one of the processes on our consideration list for quality
As you develop that policy, and hopefully rather than sooner than later, I would like you to communicate with my office as to what we're doing to shorten that period of time.
Certainly,
I really
Senator.
appreciate that. Thank you.
That would be helpful for the entire committee to have, frankly.
Sure.
If you don't mind. Any additional comments, Leo?
Yes, Sean Martin with the Legislative Analyst Office. We had recommendations on all of the budget change proposals. So regarding the $378,000 proposal to establish 3 positions to perform quality improvement in Los Angeles County, we're recommending approval of that, as well as the $2 million in special funds to implement quality improvements recommended in the consultants report that were discussed earlier. With regards to Los Angeles County proposal to increase the funding by $9.5 million and 32 positions, we note that there is an outstanding report regarding whether workload currently performed by health facility evaluator nurses could be performed by other position classifications. Until that report is submitted to us, we're not in a position to determine whether the current proposals, both to increase the staffing in Los Angeles County and at the state, are the most cost-effective approach. So we're withholding recommendation on both of those budget change proposals until we receive that report. In addition, we'd like to add that health facility evaluator nurse training program typically takes a year. It varies from nurse to nurse how long it takes them to complete the training and become able to go out and do licensing and certification activities and perform investigations of complaints on their own. So when you are adding these positions to the state or to Los Angeles County, it may very well be 8 months to 14 months before you really see an impact from adding that position. So keep that in mind. We had a concern with the state proposal that they are proposing, I think, 64 limited term positions. 2-year limited term positions, you'd really only be receiving the benefit of 1 full year of work for most of those positions if you were to improve them. And then with regards to the Los Angeles County, the $9.5 million, we recommend the legislature require the department to incorporate meaningful performance measures and benchmarks into the Los Angeles County contract potentially withholds the funding if the county fails to achieve these measures. We further recommend that the contract renewal be for a one-year period in order to allow for adjustments to these performance benchmarks and measures. We believe this approach to structuring the Los Angeles County contract will improve the county's accountability to the state and incentivize improvements in quality, efficiency, and effectiveness. And also the one-year renewal period. There's a lot of change going on right now. We are still fine-tuning our estimate methodology for the workload. We are looking for efficiencies and implementing some of the measures that were recommended in the consultants' reports. So we think it makes sense to relook at this issue in a year, both at the state and Los Angeles County. That's why we're recommending the one-year contract renewal.
Would it be appropriate, Mr. Chair, Vice Chair, to examine a phasing plan to bring that contract back to the state level with the anticipation of saving tens of millions of dollars over many years and appropriately staffing to accommodate that contract?
Are you, if I understand correctly, would it be appropriate to bring that contract in-house? In
other words,
so we haven't
no longer contract with LA County. Did you say it was $9.5 million to
Yes.
address these differences in salaries?
And add additional
Okay,
positions.
so over many years, we're talking tens of millions of dollars at taxpayer expense for them to do that contract themselves. I'm saying, should we not phase back and have not one county out of 58 that is doing this role for us, and much more expensively, I might add, that we transition back to the state, taking over that responsibility at less taxpayer money, understanding that there are personnel issues. It's not going to happen overnight, but something that we should try to phase in over maybe 3 to 5 year period of time and work towards that goal.
So we haven't done an analysis of what the fiscal effect of such a transition would be. However, based on the salary differentials between what the state pays and what LA County pays, over the long term, there would likely be some significant savings there. A few things I want to point out, though, regarding such a transition. First of all, the state would have some one-time startup costs in Los Angeles County to set up the operation. Second of all, there would need to be a transition period of likely 1 year, 2 years, 3 years, I don't know. But you are going to have LA County staff continue to work during that transition period. Third, we understand, I have not seen data, that Los Angeles County health facility evaluator nurses, there's somewhat less turnover in Los Angeles County than there is in the state. If this is true, as I described...
I think that might be indicative of the salary differences.
Well, if this is true, then as I described earlier, it takes a long time to train a health facility evaluator nurse and get them up to speed. So there would be that consideration as well. And so there's a lot of considerations there, but I think what should be foremost in the legislature's mind is it's thinking about any such transition is the health and safety of the people in the skilled nursing facilities, the intermediate care facilities, the acute care hospitals in Los Angeles County, so that any proposal along those nature would have to be very carefully managed with their well-being in mind.
I don't disagree.
Yeah.
While I appreciate the robust discussion on my home county, I also want to make sure that the State Department is clear that while that's a contract negotiation, that's a very important issue. We're also clear that you have a direct responsibility and oversight over a very broken system statewide right now. So I don't want us to get caught up in this conversation and lose the bigger picture, which is within our purview in terms of a system that needs help, to put it mildly. So I just wanted to put that out there. Any further comments?
Well, there were a few more questions that
Oh,
the
please,
agenda had
go
for
ahead.
us.
And then also, if you would then roll directly into licensing and certification fees.
That's
And
what
then
I'm
we'll
gonna
go
go
into the
next.
public comment. Okay, fair enough,
right.
thank you.
So, statute requires that the licensing and certification program publish a list of estimated fees by February 1st of each year. And so for facilities, the fees are based on workload by facility type as determined in our November estimate. So since our estimate and we have a budget change proposal before you for a significant increase in funding, then it therefore generates unnecessary increases in fees. So our fee report, which is posted online, is proposing that for fiscal year 15-16, that we increase fees with a cap of no more than a 20% increase for those facility types for which just the straight workload calculation would indicate an increase. And we would keep at fiscal year 14-15 levels same fees for facilities for which workload calculations indicated a decrease. No facility would receive a fee decrease this year. We have not increased fees in fiscal year 14-15. There were no changes, nor was there a fee increase, and in fact were some fee decreases in fiscal year 13-14. And the last time that any major, that the majority facility types received any fee increase was in fiscal year 12-13. And then there's an additional separate part of our fee setting, which is for our nursing home administrator program. And statutorily, those fees are supposed to be just based on the program cost. And in the past, we have subsidized those fees with some money from the Licensing and Certification Special Fund. We are proposing to increase those fees for the nursing home administrator program approximately 30% in the next year, and decrease the level of backfill from the Licensing and Certification Special Fund to put us on a gradual path of bringing that program to be just fully fee supported on its own independently.
Finance?
Kimberly Harbison, Department of Finance. I wanted to not address the fee report, but to backtrack to the LEO's comments on the limited term nature of some of the positions for the state request. The nature of the licensing and certification workload will be changing over the next few years. As they close out some of the open agent cases, it'll be more current cases. So we think the limited term request will give them more flexibility to adjust as their workload changes. And the intent also is to move people out of limited term positions into permanent ones as vacancies occur.
Got it. Any other comments, LAO? No. Okay, well, thank you very much. We'll open it up for public comment. And we may have a bit of a back and forth as issues come up, if members want to hear your response to them. First witness, thank you.
Good afternoon. My name is Cynthia Harding, and I am the interim director for the Los Angeles County Department of Public Health. And I'm here on behalf of the Los Angeles County Board of Supervisors. The Board of Supervisors supports the governor's proposal for the $9.5 million increase to the Los Angeles County contract. It's true we've had this contract since the 1960s, and the rationale for LA County having it was because of our local expertise, both our public health staff and our epidemiology staff. So when you have an outbreak in a nursing home, for example, our epidemiologists can work in partnership with our licensing staff to better address the issues. So the $9.5 million, we're appreciative of it, but there were a number of errors made in the calculations. The wrong salary levels for Los Angeles County were used, wrong indirect cost, the wrong employee benefits, and the wrong county workload hours, which resulted in 9.5. Using the state staffing model, our calculations are that we should be receiving about $14.3 million to do the workload that is outlined in the governor's proposal. So we would respectfully ask that an additional $4.8 million be provided to Los Angeles County in order for us to do all of the workload outlined in the governor's proposal. We also heard about the one-year contract. It's not acceptable to Los Angeles County to get a one-year contract. We would need a minimum of a 3-year contract. All the contracts we've received up until now have been on a 3-year term. And specifically, if we're bringing in a number of new staff, whether it's 32 FTEs in the governor's proposal or 46, which is what we think it really would require us to do this, it's 12 to 14 months to hire those staff, bring them on, get them all trained, and that's on the fastest track possible. We're not going to sign a contract for 1 year when we don't know whether we're going to be able to keep those staff beyond that time. So we would need a firm commitment with the state to help resolve what's been a chronic underfunding issue. When we use the state staffing model, For our current workload that we're asked to do at $26.9 million, we should be getting $58.9 and 311 positions. It's more than a doubling of what we need to do the current workload. So we would need a commitment from the state to help phase in additional budget augmentations over the next several years to fully meet the needs so that we can comply with all the mandated federal and state licensing and certification requirements. And then we're concerned because the $9.5 million only funds a portion of the workload that needs to be done for licensing and certification for Los Angeles County. We would need some commitment from the state that other resources would be brought in to cover the rest of the workload, because otherwise the residents in the facilities in Los Angeles County will get less services than residents in other parts of the state. And our board is extremely concerned about the welfare of the residents in those facilities, and we need to be funded appropriately to do that work. So thank you for your consideration. And
Could I ask you to respond to the LAO suggestion that the contract have certain performance measures included?
we have no problem with performance measures, absolutely, and we have no problem with the oversight. We agree with that. The performance measures need to be developed, commensurate with the funding and the staffing that we're going to have in place.
You know, one question I had is if we include performance measures, you also acknowledge that it's going to be 14-month startup, so I'm not sure how we could put performance measures in a one-year contract, recognizing that we wouldn't fully experience the reality of all the FTEs that are being suggested. So is your concept that the performance measures would be based on slow startup time, or how would you frame that?
I think that the concept is that during the first year, there's a lot of change going on right now. We're refining our formulas that we use for workload. We would have to develop the performance standards.
All right.
That would be probably we'd want advocate input into that process. And then in 1 year, we'd be in a position to come back and establish something on a long-term basis.
That would be included in the next long-term contract.
We'd also have a chance to see how well LA County did in filling the positions that we're funding them for.
Got it.
Where they are.
My assumption was you wanted the performance measures in this one-year contract, but it would be planning for the rest of the relationship, whatever that looks like. Any other, you have questions of the LA County person before we move on? Okay, thank you. Thank you. Next witness.
Good afternoon. My name's Terry William. I'm the Assistant Deputy of the Los Angeles County Department of Public Health, Environmental Health Division. Last April, I was tasked with the responsibility of reviewing and improving the healthcare facilities division for Los Angeles County and overseeing the performance for the licensing and certification program. It was a very critical time for us with budget and staffing shortfalls. And I think you brought up a couple of my questions, but I want to bring up that we really appreciate the governor's proposed budget for 2015-16, and that it clearly recognizes and concurs with the county's assessment of just how inefficient we were in terms of staffing and funding, and not just with the salary differential as well. Currently, we adamantly believe that we do not have the appropriate level of staffing to be held accountable for all the work that we're currently being held for, both in the quantity of work and certainly not in the quality of the work. And we're contractually obligated to this work right now. The expectation to complete all the required work using the new state staffing model and populating it correctly comes out to 331 FTEs. I'm currently funding and working with 151 FTEs. Now, I mean, let me be clear, 331, and I have 151 FTEs. So I think you can imagine with 119% staffing shortfall, there's going to be issues with quantity and quality. And I have a staff who works very, very hard, but I truly believe it's an unreasonable level for any staff to work at. And by anybody's expectation, to work 119% understaffed is simply impossible. The the governor's proposal also recognized something very important. Not only did it give us an increase of the 9.5, which we believe should be 14.8, but it also decreased the level of work that we're going to be responsible for by 32%. I'm just trying to give you an idea of how short-staffed we were. Increase our staffing by 48% and decrease the workload by 32%. So in terms of performance, we've been in a pickle. And in terms of performance measurements, certainly I'm a very accountable manager, and I appreciate performance measurements. I just want them to be fairly and equitably laid out, commensurate with the trained staffing, and we certainly want to be held accountable for that. Thank you very much.
Thank you. Are there representatives in the public from other counties? No. So we heard that the state has performance expectations that would require a staffing level much higher than what's being proposed. Are other counties suffering from the same, I guess, period of reduced funding? Are they also struggling with their ability to get the work done based on the new state standards, but experiencing historical reduction in funding?
So a couple of things. We acknowledge, and I believe our BCP acknowledges that the $9.5 million was not intended to fund Los Angeles County for the entirety of the workload. It was part of a phased-in approach addressing some of the other concerns about seeing. So we acknowledge that that does not cover the entirety of the workload. With regard to other counties, Los Angeles County is the only county that we have this relationship
Right, so I shouldn't have framed it that way. So across the state, though, is the woman power adequate in your program to meet the same kind of high standards that LA County and you are attempting to live up to?
So a couple of things have it. One, because of salary increases that occurred mid-contract, Los Angeles County has not filled all of the positions for which
Because of lack of
contracted.
resources.
So that put them, in a different position than the rest of our district offices around our state. And then in terms of achieving the workload in a timely manner, I believe, as all of the BSA audit and the Hubbard report and the federal government has acknowledged that the state as a whole has not fulfilled expectations for timely completion of the entire workload.
Got it, thank you. Mr. Stone? Okay.
I empathize with you that, you need 331 positions to do the workload of 151. And part of that is because you have to pay your workers more and you have a certain budget. And I understand you're coming here now asking for $15 million. And would it not be to your advantage to hand it back to the state and say, hey, you guys do it, because you can do it a lot more cost effectively than we can, and we have limited budgets. We're doing more with less, just like our state workers are.
Can I take the fifth on that?
Okay, you got it.
Yeah, because the state, I haven't seen the state saying, come LA County, come home. I haven't seen that either.
If I could just comment on that, though, we have an excellent Department of Public Health, and we have the ability to do an excellent job in our health facilities program. And the 151 staff we have are incredible, but they're working double time. They're taking shortcuts, so it doesn't show if you're looking at a performance level, but they are excellent.
My comments were never intended to say that you
I
don't have the
understand.
highest level of professionals coming from a county, because I came from a county, as you know. And I believe in local control, but I also believe that we need to look at the taxpayers that are struggling in this state. We have, Prop 30 that might be coming to a conclusion soon. We're going to be taking over more of the ACA. So let me tell you, this legislature in the years to come is be taking a scalpel to the budget, trying to find ways where we can save $15 million here, $5 million there, $20 million here, because we're going to be going back to deficit spending here if we don't watch what we do here in the coming years. So please, no disparaging comments to the professionality of your nurses. I think they're fantastic. And I'll say the same thing for the state of California. I think we've got very dedicated professionals that work in the state of California, and there's one common theme. We're all doing more with less, and I applaud you for that.
Thank you very much.
Thank you, and just point of clarification, as reflected in the write-up, which I'm going to find in a quick second, the fee, the funding source for this program is not general fund, it's from fees. I'm going to find it in a minute to actually read that point. But we'll go on to, thank you very much. We'll go on to the next witness.
That's a good point.
Oh, right.
Madam Chair, members, I'm Brandon Tartaglia with Disability Rights California. We support the department receiving additional resources for new staff to expedite the backlog of citations.
So it's not you, it's our adjoining hearing room, we think, or is it him? I don't mean you, I mean, you know. Okay, great, let's do that. Should we just, can we get the standing mic since we have such a long line? Perfect, thank you. We'll get the standing mic so the mic will come to you all, since that mic's being sensitive. There you go. You can start at the top of your comment again, please.
I'm Brandon Tartaglia with Disability Rights California. We support the department receiving additional resources and staff to help expedite the backlog of citations. But if they're going to get that money, we believe that there should be some timelines around how long these investigations can take. Through our research, we've seen some of these investigations take, involving a death, it takes 7 years to conclude. And for example, in one facility, there was a 4-year-old boy who died because he knocked out his breathing tubes. While the 3-year investigation was continuing, there was a 4-year-old girl who died of the same exact thing in the same facility because it was left uncorrected. So these types of things are preventable. So we just want to see some timelines around at the very least, the most egregious of the citations involving death or near death. So we look forward to working with the legislature and the department to make that happen.
Thank you very much.
Thank you.
Next witness, please. Come forward while we get the hand mics set up.
Thank you, Chair Mitchell and members. Gary Passmore with the Congress of California Seniors. Actually, there are 2 topics that I want to talk about under this subject of your agenda. First, let me tell you, I haven't been around 30 years, so I didn't see the first contract, but I have been around for 12 and a half years, and this issue has been in this room as a problem for every one of those years. This isn't a matter of the recent budget meltdown in California. This was a big issue and a big problem, and it wasn't being done right or adequately in 2004 or 5 or 6 or 7 or 8 when the bottom fell out. So if this becomes framed in your minds as a short-term fiscal crisis that can be solved by making reinvestments, no way. This is one of the things that the state of California does worst. This is one of the biggest problems in state government, and that is its oversight of frail, elderly, and disabled people in institutions. And I'm just picking that long-term care institutions. I know this is a broader issue. I have heard explanations about inadequate staffing. I have heard explanations about high turnover. I have heard explanations about the contract. I admit I did hear something today for the very first time. I didn't realize bulky laptop computers were part of the problem, and we did hear that explanation today. I am as cynical as I can get on this subject. You just need to do fruit basket turnover with this program. I don't know whether it means you need to get rid of the LA contract or whether or not the state ought to get out of this business. There is fundamentally something wrong in the state's oversight and protection of our most vulnerable people. So let me step back and contrast that with one of the programs that works really, really well. and it hasn't been brought up, so I'll just throw it out there for you. It is part of this issue, though, and that has to do with the long-term care ombudsman program that is financed out of the citations account. And thanks to the persistence and the cleverness of your staff person, she identified that there is likely some money in that account that could be used for the purpose of funding long-term care ombudsman. We are grateful to her and to you for having her here. The long-term care ombudsman resolves many of the same kinds of issues in long-term care facilities that you heard about here, but does so before it becomes confrontational. It resolves issues between individual patients who are frail and elderly. The long-term care ombudsman is the eyes and ears and voice for the voiceless. And keep in mind that some 60% of the people in long-term care facilities do not have anybody who's coming in to check and see how they're doing. Are they okay? Is the room clean? To hear any feedback. And the ombudsman provides that, and it also looks at the whole facility, and it can negotiate in the instant with the manager or the staffer or the provider of the care about problems they're hearing, and they get resolved without waiting 7 years and people dying.
Because it's right there, local on site.
It is. And right now, the state is systematically starving the long-term care ombudsman program. We removed all general fund support for it several years ago. There has been some special fund support, and that's the issue that's up today, is about, I think, $600,000, correct me if I'm wrong, Michelle, that might well be available and not be reverted back to the general fund. We, as an organization that advocate for seniors, think that citations of nursing homes shouldn't, the funds that are derived from those citations shouldn't go back to pump up a bigger surplus in the budget, in the general fund. The money should stay where the problems are, and we strongly urge you're allocating those funds that are deemed available for the long-term care ombudsman.
Thank you very much. Appreciate it. Next witness.